Thank you for joining us to talk a little bit about your grant.
Yeah, it's my pleasure to join this meeting.
Well, fantastic. Well, we got a lot of people who want to, talk with you here today. Obviously, we want to talk about your intranasal grant. This is kind of I guess, the second variety of grants that we've had, going back all the way to 23, I believe, right?
Yeah, I think so. Yeah.
Okay. Well, before we go ahead and talk a little bit about the specifics of that grant, we wanted to let you know that we have good news to start it out with. The DIPG DMG Collaborative has
Oh,
decided to go ahead and fund your
wow.
grant in its entirety. I got to hold it up so you can see it.
Oh my God, 200K.
200,000 US
Oh,
dollars. So
oh, thanks so much.
congratulations. It's
Yeah, yeah, thanks so much. And then this is, it's fantastic it's not only for my research, but also like other activity work on pediatric brain tumor so as well. So it's very yeah, thank you so much. Grateful. Yeah.
Well, exactly. Well, then I'm going to go ahead and turn it over to some people who want to say a few things to you, and then we'll get into a little bit of the grant if you don't mind. So we're joined here by Lonnie, and Lonnie wants to offer his congratulations as well.
Hey, my name's Lonnie Kaplan from The Cure Starts Now. Just wanted to congratulate you on this great grant. My 5-year-old daughter is currently battling DMG out in Philadelphia. So keep up the good work, and we appreciate everything you do every day. I want to send it to Jackie now, who has a few words.
Hi, Dr. Hashizume. It is good to see you again.
Yep.
Like Lonnie said, I'm Jackie with The Cure Starts Now. But more importantly, I am the proud aunt to Elena, a DIPG angel. So that's what makes your work and your research and what you do so much more important to families like us. So congratulations and thank you very much, very much. Um, I'd also like to introduce Yuki.
Thank you, Jackie. I just want to quickly introduce everybody. It's representing from Cure Starts Now Japan. So Director Takao Nukui, and also the another directors Miki Sasaki, as well as Kojima Noriko. Noriko Kojima. And I'm also the director of the Yuki Iwaka as well. おめでとうございます, Rintaro sensei. So,
ありがとう。
congratulations to Dr. Rintaro. So, I'm going to speak both. We are honored to be here to celebrate your significant contributions in the effort to find a cure for DIPG. Your dedication to research and raising awareness has greatly advanced the mission of Cure Starts Now Japan. And we first met you in Banff conference in July. I see the significant improvement in Japan. And also without your guidance and continued support, we won't be here right now. So thank you so much and congratulations. おめでとうございます.
Yeah, thanks so much. I deeply appreciate your, effort to fundraising and also continue to support for pediatric brain tumor research.
Sorry, I have to pass on to Rachel now. She has a few words to say. Sorry about that. I almost forget.
Hello, my name is
Hi.
Rachel, and I'm the research support coordinator at The Cure Starts Now. And congratulations on your award. We are excited for you, and you have a whole team of people around the world that believe in you and support your research and look forward to seeing the results. So congratulations again on your grant titled Intranasal Delivery of Oncolytic Virus in DMG. We know that you had some funding back in 2023 for intranasal treatment delivery. Can you please expand on how this new funding builds on your prior research and how it is different?
Yeah, so this time is we're using oncolytic virus instead of chemotherapy. So before we're using a nanoparticle encapsulate some chemotherapy. But then, I'm very struggling to, approve or get the manufactured material. So that, internet delivery is, moving in clinical trial right now, but, very hard to, get a manufactured level clinical grade of therapeutics for internet delivery. So that's why I'm looking for very, quickly moving into the clinical trial. So that's why we collaborate with Greg Friedman, who is right now in the MD Anderson. So he already used oncolytic virus for the treatment of pediatric with high-grade gliomas and phase 1 to clinical trial, and then showing very promising anti-tumor activity and also increasing the survival for the patient with high-grade gliomas. But the problem is he using delivery to the oncolytic virus into the brain, directly inject into the brain. So that's going to be very invasive, and also only 1 or 2 shots to inject. We cannot do multiple injection for oncolytic virus. That's kind of a little bit less effect compared to multiple dosing or treatments. So that's why we're going to use internet delivery, which is non-invasive, and we can repeat the treatment using oncolytic virus. So this is the first time to use internet delivery approach for oncolytic virus and herpes simplex virus. So this virus already approved, and then this virus only effect on tumor cells, not effect on normal cells. So it's very less toxicity, and also internet delivery very non-invasive. So that's we hope if this work, it's kind of a game changer for this treatment for brain tumor. So that's why I propose internet delivery oncolytic virus, and we already have a virus from Greg Friedman give me a virus already, and I have an animal, and then we did already internet delivery so many therapeutics. So it's ready to go. I think it's if we show the feasibility of this method, and then less toxicity and showing the efficacy, it's easy to moving on the clinical trial. So that's we propose, and then different from previous funding research.
Great. Thank you so much. That's exciting to hear. And thank you again for sharing.
Well, and once again, congratulations. I know that this year's a big year. You're actually part of the medical advisory committee for the Cure Starts Now,
Yes.
which actually makes it more difficult because I think the group is more critical of members of the medical advisory committee's grants than they are of anybody else's. So you had a very high performing grant in that mix, and that's difficult to achieve.
Yeah, I'm kind of scary because I review so many, grant, and then it's not list. My grant is not listed, so maybe I lose. But anyway, I try to honestly to,
Now,
review.
yeah,
But
you're unfortunately do not get to vote for your own grant, but
yeah, I
I
know.
know that the rest of the crowd typically is not easy on other
Yeah,
members, and it is a good grant. It's nice to see these delivery methods and really try these out. So we're excited about it. I think you also know how many grants. I mean, this has been a year where we've seen a lot of funding being cut,
yeah,
and the grant cycle has been delayed a bit as we've been trying to respond and try to pick up some of that momentum that I felt was lost with it. And this is going to be a really, really big grant year. So we're
yeah,
excited.
yeah. Thank you so much for your fundraising. It's amazing. It's amazing fundraising for pediatric brain tumor research. CureSat now it's, I think, a big three, foundation right now.
Yeah. Well, we appreciate it, and we have to keep up with you.
Yeah, thanks so much.